Life, wisdom.
I'm Psyche Truth correspondent Karina Rachel, and I'm joined today by Dr. Colin Ross.
Hi.
He is an author and practicing psychiatrist based in Dallas, Texas. Thank you so much for being here with me today.
Always a pleasure.
Today I want to talk about a really important topic in our society, money. The pharmaceutical industry is one of the most profitable industries in the world. And I was wondering if you could just tell us a little bit about how the money influences our medical health system.
Well, money and pharmaceutical money influences psychiatry, medicine in general, but psychiatry, big time. And I actually was inside the machine back in Canada. I moved to Dallas in 1991. So I, as a resident, did the first drug study for a drug company that was ever completed in the province I lived in, which was buspirone, which is an anxiety drug that doesn't have the sedating, addicting properties of Valium and that group of drugs. And it was Bristol Myers was the company, which hadn't yet joined together with Squibb. And so I basically, there's a research nurse who took care of the phone calls because people would call in because we advertised in the newspaper to find participants. She would screen them and I would interview them, and then they would come in person. And in the end, there was 10 people on Valium, 10 people on the new drug Buspar, and 10 on placebo, on what's called a double blind. So I didn't know which they were on and they didn't know which they were on. And we did every week a standard measure of anxiety, followed them for 4 or 6 weeks. And I actually published that in the Canadian Journal of Psychiatry. And then I was involved in antipsychotic, antidepressant type studies. And from that one study, which was 30 patients, there ended up $42,000 in my research account that I used for other research projects. But if I'd been doing that as a business person, I would have made a profit of $42,000 from interviewing 30 people once a week for 4 weeks in the 1980s. And then I got 5 or 6 drug company paid trips around Canada to do talks about the drug or attend meetings. I got a free trip to Texas and a free trip to Italy, which included airfare, attending the conference, really expensive, up above on the hills above Florence, dinner with about 15 people, and I got a trip to Dusseldorf, Germany. Those were the perks I got, and Dusseldorf again, first class airfare, stay at the Hilton, have dinner on a boat on the Rhine River, all totally paid for by the drug company for one study of one drug with 30 patients in it. Then that's the level of perks. If you look at the American Journal of Psychiatry, which comes out every month, it's about this size, and there's 30 glossy colored page ads every issue, paid for by drug companies. So the drug companies are keeping many of these journals afloat. If you go to American Psychiatric Association meeting, there's huge exhibit halls with drug company booths, very, very big booths, giving away all kinds of things. And it's only just in the last 10 years that the government and psychiatry and the medical schools have started to put a bit of a clamp on the level of perks that the industry offers psychiatrists. So it's literally a multi-billion dollar industry with huge perks to psychiatry.
Right. That's very interesting. So it sounds like there's a situation where these pharmaceutical companies are going out and funding this research. Certainly there's an incentive to come up with the results that they're looking for, or they have an opportunity to favor studies that come up with more favorable results.
Well, that's another odd part of the story. So the study that I did, which was the Buspar versus diazepam, which is Valium, versus placebo, there was no difference between the 3 groups. The anxiety scores dropped nicely, but no more than they did in the placebo group.
Interesting.
And I was actually at this conference in Dusseldorf where the drug was being launched in Germany for the first time. And a guy who had done 100+ drug studies in Canada, was kind of the senior drug study guy, was talking to me and said, that's common. That was your first study, right? So you'll get the hang of this and you won't be quite so kind, quite so attentive, and you'll learn to drop down the placebo. And so I said to him, well, wait a minute, I only saw these people for an hour the first visit, which is all taking a history, filling out questionnaires. The visits in between were literally 15 minutes each. I did no therapy of any kind whatsoever. But he actually thought you could crank down the placebo effect by being a little more cold, distant, and uninterested, and that I would get the hang of that if I did more studies. But when you look at the literature, say for antidepressants, it is a fact, if you look at published studies, there's a little gap between drug and placebo, and statistically it's significant. That's a scientific fact. So psychiatrists always say, we have proven these drugs are significantly better than placebo, which technically is true. But the thing is, the gap isn't very big. That's when you look at the studies that have been published. But people who've actually filed Freedom of Information Act requests, who've gotten all the unpublished studies that were funded by the drug company but suppressed, when you add those back in, the difference between antidepressant and placebo basically goes to zero.
Wow.
Which is a scientific fact that's been published in the literature. And so the curious thing is that the drug companies aren't actually, in fact, getting the results they want. The results they're actually getting are, yes, the drugs do, in fact, work for some people, but not any better than placebo works. So it's not that the drugs are totally useless and don't work at all, because placebo, in fact, is quite an effective medication for many different things. And there's even studies where you give somebody placebo, and then if you augment the placebo by adding on another drug, a few more people now respond. But what you've added to the placebo is another placebo. So there's all these studies showing very clearly that the placebo is something real. It does affect how people feel, behave, experience the world. Drugs also do that, but no more than placebo does. That's what's scientifically true about pretty well all psych meds.
So it sounds like the pharmaceutical industry can be somewhat selective with which research findings they publish and which ones they don't. And especially since most consumers aren't actually going and reading the scientific studies themselves, we get most of our information through what we're told by our doctor or what we're told by, commercials about pharmaceutical drugs. Seems like the scientific evidence itself is almost irrelevant.
Well, the scientific evidence has actually been hidden. So there's several layers to this. So there's the actual scientific evidence from all the studies, but only the studies that actually showed a difference between drug and placebo tend to get published. Mm-hmm. And the ones that showed no difference tend to get suppressed. Right. So then the actual scientific facts are hidden even from the literature, because when you read the literature, you only see the more successful studies. And so that would be what the doctor would read if he read the literature at all. Mm-hmm. But then the doctor gets much of his education from the drug rep, and the drug rep is representing the drug company. Mm-hmm. And then the patient gets information from the doctor, who's got information from the drug rep, or from the ad on TV, which is all controlled by the drug company. Right. But even when the doctor is in the loop providing the information, the doctor historically has not had access to the whole body of scientific facts. Mm-hmm. So that's the way the whole system operates. When you look at the Hamilton Depression Scale, you can score from 0 to 51 on that scale. And if you look at all the studies lumped together, the difference between drug and placebo on that scale is less than 2 overall, on a scale from 0 to 51. So a difference of less than 2, you wouldn't even be able to tell or notice. And the doctor couldn't tell you who's the person whose score is 2 better than the other person's. Plus, on that scale, your score can drop by 2 if you just start sleeping better, mm-hmm. or if you get your appetite back. That's all that has to happen. Right. So these are tiny, tiny little differences that have no clinical meaning whatsoever.
So it seems like there's a discrepancy between the message that is conveyed in the advertisements that we see on TV, or that's conveyed by drug representatives to doctors, is really not a true representation of what the scientific evidence is finding.
That's correct.
Interesting. And then beyond that, we're dealing with people, and every single person is going to be different. Certainly if you interviewed 30 people here and 30 people in a different place, you would get such different results. And then, as you just mentioned, there's so many different factors, like how the person is sleeping, how they're eating, what kind of stressful events are going on in their life. And none of that can really even be, examined by a scientific study.
Well, the core problem always comes back to the same thing. If you have a diagnosis of pneumonia, which is an actual medical diagnosis, first of all, you have symptoms. Okay, so that's good. You have symptoms, but you could have the same symptoms just because of air pollution or for 100 different reasons. So the doctor then does a chest x-ray and maybe gets you to spit in a tray and they see if there's bacteria in there. Or if necessary, they can actually put a scope down and take a biopsy. And then you have a specific bacteria that's in there and you have a specific antibiotic that is known to be good for that bacteria. You treat, the symptoms go away, the x-ray clears up. It's actual real science. Mm-hmm. The core problem in psychiatry all the time is we don't have any of that objective evidence. We just have the symptoms. So if you're just looking at the symptoms of pneumonia and calling that pneumonia, you'd have some people who have those symptoms because of a virus, some because of bacteria, some because of cancer, some because of a heart problem. You'd have literally dozens of different causes of these symptoms. And if you just gave an anti-pneumonia to everybody, or you just gave the same antibiotic to everybody, only a tiny percentage would benefit at most.
Right.
And that's kind of the situation of psychiatry. You've got people who are all, quotes, depressed or all schizophrenic, who actually have all kinds of different ways they got there for all kinds of different reasons, and we just have this group of drugs we give. And we know for a fact the drugs don't work very well.
Wow.
But there's no reason why you would think that they would if you just have one basic set of drugs that you're giving for pneumonia all the time.
Right. Well, that is incredibly interesting. I'm going to go ahead and wrap up for today, but thank you so much. Please be sure to like this video and leave any comments, questions, or topic requests. I hope that you will subscribe to Psychiatry so you can see our future videos where we'll be talking more on this topic. Thank you so much for watching, and I look forward to seeing you again soon.